Hello, Cook County. This is Dr. Farchmin from Sawtooth Mountain Clinic. This is part three of a three-part series just on an update on coronavirus or COVID-19, as you may know it. Um, so this last part, I want to focus on some of the information out there. Some of it's misinformation, some of it's, in my opinion, misinterpreted. And I know that there are people who may disagree with what I'm saying, but I really wanted to bring it back and talk about some of the issues out there that have caused a lot of confusion. But before I jump into that, I do want you to be skeptical on the information you're gathering. So a lot of people are making claims that they don't have expertise in, and I will come straight forward and say I'm a family physician. I'm not a researcher when it comes to coronavirus. I'm not a public health expert. This is me as a family doc, as your family doc, just trying to interpret the information and get it out to you. So take that with a grain of salt. But I also encourage you to take with a grain of salt the information that's out there on the internet, because there is unfortunately some pretty bad information being spread pretty widely out there. And hopefully this brings some clarity to it. So when it comes to treatment, this was a big issue a little while ago. So what I just want to say is we do not have a cure for this. We do have hope that we're able to blunt some of the effects of this. And to just put it in perspective, think about the common cold, think about other things. We don't have treatments for it. And it's because it's a hard thing to treat. We do have the Tamiflu for influenza, but remember that just shortens the illness by about a day or so for most people. It doesn't cure it. It doesn't get you right back on your feet right away. And that's, I think, what we need to be expecting for our treatments for this. The good news is we have some hopeful candidates that have shown to improve outcomes. You may have heard about remdesivir that has shown to reduce the severity of illness and get people out of the ICU faster, which is a big thing and a good thing. The other one is dexamethasone. It's a steroid. And these have both shown to improve recovery. I'll talk a little bit on the next slide about the timing of that, but those are good things. There's been a lot of conversation about hydroxychloroquine. It was initially thought to be helpful in small studies. That's how a lot of things start. We get a lot of potential therapeutics that seem like they've got some potential, but when we really look at the big studies, they don't come forward. And that's what happened with hydroxychloroquine. There's a lot of studies out there, and it was consistently shown to not be effective on the vast majority of the trials. In some cases, it was potentially harmful. That's more debatable, but it's pretty consistent that this is not an effective treatment for COVID-19. The other thing is the idea of herd immunity. It's been talked about as a strategy here, but I'm going to try to give some clarity on that and talk a little bit more about it. So the idea of herd immunity you can see here. So the blue people on the left are people who are not immune to an illness, and the two red people are those who are infectious. And you can see that it can spread very quickly when they're surrounded by people who can get infected. This part shows the blue people are still those who can get infected, but the yellow people are those who are immune, either because they had a vaccine or they had the illness and have lasting immunity. And you can see that there's only so many people in those circles that can get infected. That physical distancing plays a role here, but you can see if a large portion of the population is immune, it just doesn't spread and get people sick at the same rate. Some people said, well, let's get there quicker, and then this thing will slow down. We know that herd immunity seems to settle in somewhere between 50 and 70% of people being immune will slow down an illness. The problem here is the number of people that get sick at the same time. I've come to think of herd immunity as the destination that we are hopefully heading to, but the journey can be very different as to how we get there. So picture us here on top of that mountain, where that red dot up on top. If we just open things up, if we say we're not going to do anything, we're just going to try to get herd immunity as fast as we can, it's going to be a free fall, and it's going to be a bumpy ride, and a lot of people are going to get sick, and we're going to get overwhelmed. The other option is a harder, slower route but one that has less damage on the way. And that's going slowly down the more gradual slope. That's with the physical distancing that we're talking about. That's with closing businesses down if they are shown to be areas of transmission. It's slowing the economy down. It's doing all of those things. It's limiting our travel. It's painful, it's hard, but it slows it down, and we're not seeing the same surge on the medical system. If we can do it long enough, we're going to have to go slowly down. But hopefully at some point there's going to be a vaccine. And so I've drawn a crudely drawn gondola there. If we can get that vaccine, we can get to hopefully a herd immunity much quicker and easier. But right now we are heading downhill one way or the other, but our choice is, do we go more slowly down, or are we going to go into more of a free fall? And that's the decision point that we're at. Herd immunity isn't really the strategy, it's the end goal. One of the other big topics out there right now are cloth face coverings. You may hear them talked about masks, but that can be a little misleading. We're really talking about the cloth face coverings. The masks can also include the medical grade masks that we wear. And so I just want to be clear, those we know block virus particles, but the cloth face coverings is what I'm talking about now. We think that they can help. The scientific data is preliminary. We're still studying these. It's going to take months to really get hard data on these. It's a hard thing to study. We wish we had the hard data when we make a recommendation like this, but the reality is we just don't have time to do that. This virus is actively spreading, and we need to use what tools we have. And this is a relatively easy thing to do. The idea is that they're going to catch the droplets, the bigger droplets and the medium-sized droplets. It's going to catch them in a mask and keep someone who may be infectious but not know it yet from spreading it around. There's really no information out there on whether they provide any protection for the wearer. Right now, the main thought is to keep this from spreading, because we know that people can spread it before they're feeling sick. And that's why we're recommending that everyone wear them when they're in higher risk areas. If this is a truly airborne disease, it may be limited, but we know at the very least that we are slowing down some of the bigger droplets, and that's why we're recommending that people wear them. There's concerns out there that they're dangerous and cause hypoxia. Certainly for some, they can cause a claustrophobic feeling, but we know that they do not cause hypoxia. Air is able to move freely through the cloth face coverings. But certainly some people do struggle to wear them, especially at the beginning. And so we do recommend that people gradually increase their comfort level with this, but they are not a dangerous thing to be wearing. There's a number of other claims that have been floated around there at different times. These are not substantiated. 5G towers have been implicated either in causing it or in the monitoring of it. I've never seen anything that substantiates that. There were concerns about it being a bioweapon out of China. They have looked into this, and there's no evidence to support that. There's also concerns that it was a lab accident out of China. Again, multiple reports that I've seen in the medical literature have not supported that. There's others out there. I just encourage people as they look at that to consider the source and really get to the bottom of it and make sure that it's an accurate information that you're getting. Thank you for listening. This is just an opportunity I wanted to take to try to get people updated on how I'm understanding the coronavirus and to get some information out there. I encourage you to be skeptical. I encourage you to check my facts, and I want to stress the importance that things will change. Some of these will be out of date at a later time, and so keep yourselves educated. These are the references that I use, and I encourage you to use them yourself if you want to dive into the data. So the general references in the CDC, Minnesota Department of Health. You can look at numbers and trends if you're a numbers person. Johns Hopkins has a big website devoted to this. We also have some good local information. Minnesota Department of Health does include Cook County information if you dive into it. And then we have our own Cook County Hub data that talks about our testing, and encourage you to take a look at that. I get most of my medical information from the reports coming through the New England Journal of Medicine, and there's a link. All of that information is freely open to the public. So thank you for listening. I hope this has been helpful. I hope this helps you to be engaged and active members of the community in terms of keeping us safe, and is useful information. Thank you.